RQI is a really easy system to use.
This is a low dose, high frequency type of training.
When I was using the RQI mannequins, it felt very natural. It felt very real.
With RQI, Saint Alphonsus is now utilizing the most up-to-date science in resuscitation training.
The Saint Alphonsus Health System is made up of 4 hospitals and approximately 72 clinics in the Boise area and southern Idaho and eastern Oregon. We also are the region's only level 2 trauma center. We have approximately 6,000 colleagues and we serve hundreds of patients a day. In a traditional model, a colleague has to be taken off of their floor in order to do their advanced life support certifications, and that is non-productive time. With the implementation of RQI, this is going to help keep them at the bedside with our sickest patients.
I work in an ambulatory setting where anything can walk in the door. And so having RQI as a part of our education and process for making sure we maintain our skill sets, we'll be able to handle those situations much more easily and with a lot of confidence.
As the American Heart Association updates their resuscitation guidelines, the RQI platform automatically receives those updates. So there's no waiting for textbooks to be updated, for instructors to be educated on those updates and guidelines. The learners are literally practicing in real time with the most up-to-date resuscitation science available.
During our kickoff event, we're going to have multiple super users there that were trained earlier, and they're going to help train some of the staff members as well.
I've had an opportunity to go through the RQI system myself. I was a little hesitant about the mannequins at first, but using these mannequins have been so different than others in the past. There is real-time feedback that allows you to make corrections immediately, and it's been really great to work with.
You can see the depths of your compressions. You can see the amount of volume you're getting into the lungs and getting my timing down. And by doing that every quarter, giving real-life CPR is going to be amazing. It's going to be so much more beneficial.
It was really interesting to walk through that first set without any feedback and not knowing how one was doing. And as soon as the feedback starts, it's a rapid improvement process.
When we made the decision for mannequins, we actually chose a mix of both the stations and the Go mannequins. The Go mannequins that we chose are because we have so many clinics that are not on our hospital campuses, and they're going to be traveling for 2 to 3 weeks at a time at each clinic to give that clinic the opportunity to not have to travel to do their competency validation.
The entire Saint Alphonsus Health System is implementing RQI at the same time. I think this is a great advantage for us because everyone is on the program getting the information constantly. Our continuity of care across our whole system will be seamless with everyone on this program at the same time.
Now that we're a year out from our launch of RQI, one of the biggest things that my clinical education team has noticed is that we have to do a lot less coaching on skills. Our colleagues come in, they know how to do the compressions, they know how to do the ventilations. They're all using the adult ambu bag, which was always an issue in our previous models.
Saint Alphonsus rolled out RQI for all 4 disciplines. Those disciplines are BLS, ALS, PALS, and NRP. The rollout consisted of about 4,000 learners across 4 hospitals and 84 clinics.
RQI has been a game changer for nursing leadership of a unit and scheduling. I don't have to take somebody off the schedule and worry about that staffing hole. It has been 150% a positive attribute.
I think RQI takes a lot of variability out of what we had seen prior in terms of our assessment around BLS and Code Blue situations. Whereas, prior assessments might be individually instructor-led, and you have different personalities, you have different focuses and biases, right? RQI addresses all of that by keeping it consistent and standard, user by user, regardless of role type.
When the situation presents itself or in a code, I have not seen anyone hesitate to do their job the way they're supposed to do it. And in the post-code evaluation that we do try to do a quick little summary at the end. I think the consistent message is they felt prepared and they knew what to do and how to do it.
Since the implementation of RQI at Saint Alphonsus a year ago, skills proficiency has increased 13% for the adult-child compressions and 25% for the adult-child ventilations.
I know our staff members are much better prepared than they were before. And we've heard that confirmed in several conversations as we've circulated throughout the clinics this year. And I'm very excited to see how we will continue to improve in our expertise and our ability to handle those situations as we use RQI in the future.
Working with RQI partners has been a fantastic journey. Whether you're dealing with impact managers, the implementation team, or customer support, one of the things that is truly evident in everybody that you work with at RQI Partners is that we all have the exact same goal in mind, and that is truly making an impact with patients in our communities.